This patient who's entering this moment the radiology department is a woman coming from UK who has received a couple of years ago a surgery, major surgery for the cancer of the rectum. Unfortunately, this patient has needed afterwards a chemotherapy plus radiotherapy because of local recurrence. Today, we are going to do a cryosurgery of the bone of the sacrum, where the patient has the metastasis that causing her a lot of pain since she cannot sit comfortably and she needs medication. We are going to do cryosurgery under local anesthesia. We clean the skin, we do an injection of local anesthetics, and immediately after, under CT guidance, that means that we are looking at the CT screen in order to know what we are doing. We are inserting 2 cryo needles. We call cryo needles the needles that are going to give the low temperature that will destroy the tumor where it is. While we are looking at the CT screen, like this, we really know exactly what we are doing and where we are inserting the cryo needles. The iceberg caused by the 2 cryo needles is the area of frozen tissue that achieved the destruction of the tumor. And we see it under the CT guidance. This allowed us to really know what we are doing. And after this, that has been done totally under local anesthesia, the patient can go in her room, in this case, and being totally awake, will be released the second day after surgery. That means that tomorrow we are going to check her conditions, and if everything is okay, as we hope, as it should be, she will be able to go home immediately. Day after, we checked the patient in order to see if there were any bleedings, problems, fever, infection, or something like this. And as almost always it is, we didn't have none of them. Interesting to note, the patient was able to sit comfortably, pain was gone, and we hope really that this will be her permanent result, as it usually does with cryo. Cryosurgery is an excellent therapy for pain caused by tumors, metastases near the bones or inside the bones, since the destructive effect is immediate and can be done in local anesthesia with very little discomfort to the patient, and especially in those conditions of very difficult patient where other previous lines of therapy has not been good enough to treat the disease.